Right. We're going to talk about what we have to do if we have to move to endotracheal intubation for unsuccessful placement of the iGel or King airway. Again, the supraglottic airway should be our primary choice to minimize the amount of time we're exposed to aerosolization in these patients. So we have our suspected COVID-19 patient. We have an unsuccessful attempt to pass the iGel or King. We want to do bagging with 2 hands with the thumbs down. So we're going to pull the jaw up and then push the mask into the face, and a second person is providing ventilation. Our viral filter and end-tidal CO2 device are already in place. And when we're ready to make our attempt, again, we want our most experienced provider to be doing that. I'm going to remove the N95 mask for this so you guys can all hear me. We prefer a video technique, and I would recommend using the bougie with your tube in advance. But this provides us the best chances of first pass success. With our video laryngoscope, we're going to do progressive visualization. So I'm coming down the tongue, following that into the vallecula until I can see the airway here. And then I'm putting my device down and the bougie going through the cords, and I'm pushing the tube through and visualizing the depth of the balloon directly on laryngoscope so I don't have to put my face down close to the patient to auscultate. I'm removing the laryngoscope and my bougie, and then I want to put the balloon up on the endotracheal tube before I begin ventilation. I removed the mask, but not the other devices we had on the bag valve mask, so that our inline end-tidal CO2 and filter are already in place. And then I can look for my end-tidal CO2 waveform and then potentially have someone else auscultate at a later time. But I relied on that video to know that I'm in the right place and my end-tidal CO2 waveform. This is definitely an aerosolized procedure. This is one of the highest risk procedures. You want to have everything prepped, including your backup airway in advance, and your most experienced provider performing the procedure.